Bismillahirrahmanirrahim. Assalamu alaikum. So this is a very short video about how to interpret the lumbar spine x-rays. So I'm making this video upon the request of my friends and my students. So let's start. First of all, we need to look for the views. What are the views that we are looking? So this one is the anterior-posterior view and this one is the lateral view. These are the most common and the standard views or routine views that are performed or required for any patient that comes with low back pain or in which you're expecting that he or she is suffering from spondylosis or simply the degeneration of the spine. So let's start with the lateral view. I have highlighted these structures for your convenience. You can see that these structures are marked in the yellow color. These are the bones, especially you can see the vertebral body of T12, L1, L2, L3, L4, L5 and the sacrum. Similarly, on this view, AP view, you can also identify all of these vertebral bodies and the sacrum and the coccyx. Here you can also see the coccyx. Now, these areas which I've encircled are called the intervertebral foramens. These are the points through which the nerves exit. So these are very important in the lateral view. If we are looking at a radiograph that is a lateral view, we should always try to see on these foramens that whether these foramens are clear or whether there is some abnormal appearance of these foramens, because if there is a bony spur or if there is calcification or osteophyte, that can cause compression of the nerves. Now into the vertebral bodies, we can see the shape of the vertebral bodies. It is very important. The vertebral bodies, they are more of a square rather than some other shape. So we need to remember the fact that the vertebral bodies, they need to be more of a square. So I mentioned this in one of my WhatsApp status that this is a classical view of lumbar spondylosis. Why I'm saying is because you can see the vertebral body shapes are disturbed. So L4 shape is not good enough. Even the L5 vertebral body shape is not good enough. And we can also see that if we look at the intervertebral disc space or the disc height, which can be seen on the radiographs, so you can see there has to be an increase physiologically when you descend from top to down, but in this particular case you see that there is more space on L4 L5 intervertebral disc, but between the L5 S1 there is a very little space or the space is reduced. So this is basically showing us reduction in the space, that is degeneration. And we can also look for the alignment. Now in this view, I'm typically concerned with this lateral view right now. In this view, we have to make three imaginary lines. Now this is called the first line or the anterior vertebral line. It must pass from the vertebral bodies or in front of all the vertebral bodies, but in a smooth manner. And we know that there is no contour in the lumbar spine right now, so there is no lordosis, so this is straight. So in a normal person it would be going like this, the way my cursor is moving, but over here it is straight. This is number one, the anterior vertebral line. Number two is the posterior vertebral line, which is marked onto the posterior part of the vertebral body, and then there is spinolamellar line. From the lamina of the vertebrae there is the third line. So these lines, they tell you about the symmetry or the contour of the spine or the spinal region. So in this particular region, in the lumbar spine, we do not see any curvature, so this is termed as the straightening of the lumbar spine. Most probably people have written it like this, that it is the straightening of the lumbar spine, most likely due to muscular spasm and things like that. So just we need to dig this. Then we need to look for other structures, like for example we can see the facet joints, or especially this is very important to understand. This is the inferior articular process of L4 and these are the superior articular process of L5, and we know between these two there is the facet joint. So you can also see the facet joint. The spinous processes can also be seen, and these are the major structures that you need to see in the lateral radiograph. Now, coming to this anterior-posterior radiograph, you need to look for the symmetry and you need to look for the spines processes. They should be in the midline. There should be no deviation of the spines processes. If the spines process is deviated to one side or another side, we need to say that okay, there is rotation, and if there is deviation in this view, then we might find some scoliosis, and if there is scoliosis, there is some degree of rotation that is usually termed as rotoscoliosis. You can also look for these regions. These are the pedicles, and the pedicles, they should be equidistant on the x-axis as well as on the y-axis. So between two vertebrae, the pedicles needs to be equidistant, and within the vertebra, the right and the left pedicle should be, this is the right one and this is the left one, so the pedicles should be equidistant. So the spines process and the pedicles, they should be in alignment with each other, and there should be no rotation. And here you can see this is the transverse process. We are also looking at the gas, and we are also looking at the sacrum. A very clear sacroiliac joint can be seen, or the joint line. This is basically the cartilage between the joint. So on both sides you can see this is the right side and this is the left side, and we can clearly see the SI joint is pretty normal. The ilium can be seen, the hip joint can also be seen, but we are not concerned right now with the hip joint. One important thing is, if you are assessing somebody with lumbar spine pain or low back pain, always try to correlate your findings with the the radiographical findings with your clinical findings. So they must match with each other, and you can also see for the symmetry or the alignment of the sacrum and even the coccyx. And these are the major structures and the things that you can see. If there is any abnormality, you need to write it down. You need to try to make some sense out of your findings, and you need to correlate your findings with your clinical investigations or with your clinical expertise, and then you can try to make best use of this. And most importantly, it is just a message for all of you guys who are listening to me and learning this, that please do not repeat the radiographs unless or until it is really very necessary, because it is ionizing radiation. And you can also look for one more pathology in this view, that is anterolisthesis or retrolisthesis. Usually if there is spondylolisthesis, there is fracture of bilateral pars interarticularis. This is the region that is called as the pars interarticularis, and if there is a fracture, you will see a black line running all the way from the pars interarticularis. And if the vertebra moves anterior, then it is called anterolisthesis, and if it moves posterior, it is called as retrolisthesis. Now how do we define it? It's very easy. You always mention the movement of the upper vertebra in the motion segment. Okay, so let's assume that there is L2 is moving anteriorly, so with respect to L3, so we don't say that L3 is moving posteriorly, because we always need to mention the upper vertebra. If the upper vertebra is forward as compared to the lower vertebrae, it is called as anterolisthesis, and if the upper vertebra is backward as compared to the lower vertebrae, then it is labeled as retrolisthesis. I hope you like this video. If you have any questions, do let me know. Thank you very much.